I'm Brittany Calderwood. I'm Rachel Barker.
I'm Mariana Rossi. Now I'm gonna do the valgus stress test. This test is used to assess the integrity of the medial collateral ligament of the elbow or ulnar collateral ligament. So I'm gonna have my patient sitting on the table. I'm gonna put my hand on the distal forearm and on the elbow, and I'm gonna apply lateral force from the forearm and medial force on the elbow in this way. And if during this movement we're gonna have laxity or pain, the test is positive, so we probably have a sprain of the medial collateral ligament, and we're gonna do this test bilateral to see if the laxity is gonna be the same or is different. So I'm gonna apply medial force to the elbow and lateral force in the distal part of the forearm. And if the laxity is different, so if the laxity in this elbow is larger, we probably have a positive valgus stress test.
I will be performing the varus stress test. This is to test for an injury to the lateral collateral ligament of the elbow. A positive test would indicate any laxity in this area. So I'll have my patient fully extend their arm and their elbow. And what I will do is I'm going to be stabilizing her wrist and placing my other hand on the medial aspect of her elbow. And I will be applying a lateral force and also stabilizing her elbow and doing a slight medial force. If the patient has any laxity as this force is being applied, this could indicate a positive injury to the lateral collateral ligament of the elbow. And of course, I'd want to test bilaterally as well, and to compare both sides to see if this one has more laxity. This would indicate a positive test for the varus stress test.
I will be performing the passive lateral epicondylopathy test. We are testing for epicondylopathy or tendinopathy, and a positive sign for this test would be pain around the lateral epicondyle. What I'm going to have my patient do is bring their arm into extension, and I'm going to support the elbow while palpating the lateral epicondyle, and I'm going to support the supinated forearm, and I'm going to passively move the hand into flexion. And a positive sign that we have tendinopathy or epicondylopathy is pain in the lateral epicondyle region.
Now I'm going to do the active lateral epicondylopathy test. This test is used to assess the lateral epicondylopathy or tendinopathy. I'm going to have my patient sitting on the table with the elbow full flexed and the forearm supine. I'm going to palpate her lateral epicondyle of the elbow in this way, and I'm going to ask her to fully extend her wrist in this way while I'm resisting this movement. If she's gonna have pain along the lateral epicondyle of the elbow, the test is positive, so we probably have a lateral epicondylopathy or a tendinopathy.
I will be performing the passive medial epicondylopathy test. This is a test to see if there's an injury to the medial epicondyle for epicondylopathy or tendinopathy. What I will do is I will take my patient's suspected injured arm, and it will be in full extension with the forearm in pronation. I will be stabilizing her elbow and palpating her medial epicondyle, and we will passively be moving her wrist into extension. And as that wrist is going into extension, if there's any pain along the medial epicondyle, this would indicate a positive test for the passive medial epicondylopathy test that could indicate injury to the medial epicondyle, epicondylopathy, or tendinopathy.
I'll be performing the active medial epicondylopathy test. We are looking for epicondylopathy or tendinopathy, and a positive sign will be pain, especially around the medial epicondyle. I'm going to have my patient bring their elbow into flexion with their palms supinated. I am going to find the medial epicondyle, and I'm going to place my hand on the palm of the patient, and I'm going to have them bring their hand into flexion while resisting a force. And so as they're doing that, we are looking for pain, especially around the medial epicondyle, which will indicate active medial epicondylopathy, is a positive sign for active medial epicondylopathy and is a positive sign for tendinopathy or epicondylopathy.
Now I'm gonna do the elbow flexion test. This test is used to assess the ulnar nerve entrapment and compression. This is an active test, so I'm just gonna face my patient and I'm gonna ask you to fully flex your elbow while fully extend your wrist. And you need to hold this position for 3 minutes. And if during these 3 minutes the patient is gonna have paresthesia along the medial aspect of the forearm and the end, we have a positive result of the test. So we probably have a ulnar nerve compression or entrapment.
I will be performing the radial/ulnar collateral stress test. This is to test for a sprain to the RCL, the radial collateral ligament, or the UCL, ulnar collateral ligament. A positive test would indicate pain or laxity to these ligaments. So what I will have my patient do is her elbow being flexion, her forearm supinated. I will stabilize her distal part of her forearm, and my other hand will be around her carpals. To test for a radial collateral ligament sprain, I will apply the varus force by rotating her hand laterally. And if there is any pain along the radial collateral ligament, this could indicate a sprain. And to test for the ulnar collateral ligament sprain, I will do the exact opposite and add a valgus force by internally rotating her hand. If there is any pain along the ulnar collateral ligament, this could indicate a sprain as well. And of course, we want to test bilaterally to see how that laxity compares to the other side. And if the suspected injured arm or wrist has more laxity compared to the other one, this could indicate a positive test as well as if there is pain for those radial and ulnar collateral stress tests.
I will be performing the phalanx test. What we are testing for is carpal tunnel syndrome, and a positive sign for this test will be numbness and tingling in the thumb, index, and middle finger. What I'm going to have my patient do is bring their shoulders and elbows into flexion with their arms rotated inward. I'm going to have them place the dorsal aspect of their hands together, just like that. And while they are maintaining contact with their hands, I'm going to have her drop her elbows in and hold for about 1 minute or until symptoms pop up. So those symptoms again are pain and numbness in the thumb, pointer, or middle finger, and that will be an indicator of carpal tunnel syndrome and a positive phalanx test.
Now I'm gonna do the Finkelstein test. This test is used to assess the curve ring syndrome. I'm gonna have my patient sitting on the table with the elbow flexed, and I'm gonna ask you to put your thumb in the middle of your fist. And then I'm gonna ask her to do a ulnar deviation movement this way. This movement can be both active or passive. And if during this movement she's gonna feel pain or reproduction of the symptoms, the test is positive, and so we probably have the curve ring syndrome.
I'll be performing the varus or valgus stress test. What I'm going to have my patient do is bring her elbow into flexion with her palms supinated. I'm going to be testing the integrity of the MCP and the IP joints, and we're looking for pain and laxity in these, so we're going to be testing bilaterally. So supporting her wrist, I'm going to apply a valgus force, which is medial. So I'm going to test the inflicted digit just above the MCP joint, and apply that valgus or medial force. And I'm also going to be doing it at the IP joints. And so I'm going to test bilaterally to see if its laxity is similar. So I'm going to apply that valgus or medial force, MC joint, IPs, and pain or laxity would indicate a positive test. So now we're going to do the varus force. So I'm going to apply a varus force or a lateral force at the MCP joint and also the IP joints. And then we're going to be testing bilaterally as well. So MCP and IP joints. So like I said before, pain or laxity in those digits would indicate a positive test for the valgus or varus stress test.
I will next be performing the trigger finger test. This is to test for flexor tenosynovitis, and a positive test would equal painful nodules or locking or catching during extension, where the fingers aren't able to fully extend. So this test, I will just be instructing my patient. What she'll do is she will have her hands out and her fingers in full extension. And what she will do is she will slowly flex her fingers into her hand and then slowly extend them back out. And if during this test there is those painful nodules or that catching of her fingers, or they're unable to extend fully after coming into flexion, this would indicate a positive test for flexor tenosynovitis.